When COVID-19 hit our country, many scenes were left behind. The attention shifted to national security and national health. Join me as we visit these scenes today in our video, Behind the Pandemic.
Identify the cause of the mysterious new virus.
Coronavirus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation where there is not a cause for alarm.
The first US case has been detected.
There's confirmation the coronavirus has reached Australia.
China is urging its citizens not to travel abroad as it struggles to contain the virus.
We will be standing up Christmas Island as a quarantine area.
Foreign nationals coming from China are now banned from entering the country.
I have today declared that the coronavirus presents a public health emergency in the United States.
Trying to contain a city of 11 million people is new to science. It has not been tried before as a public health measure.
The death toll now has risen above that of the SARS outbreak 17 years ago.
We now have a name for the disease, COVID-19.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
The Italian government tonight put the entire country on lockdown.
COVID-19 can be characterized as a pandemic.
We will be suspending all travel from Europe.
From Italy this evening, it just gets worse. The death toll now worse than China.
What happened in Bondi was unacceptable.
Unlike most other countries, the Philippines had decided to keep schools closed for another year to contain COVID-19. Rights advocates warn millions of children without internet access are missing out on an education. As schools around the world gradually welcome back students, the Philippines has decided to keep schools shuttered for another year as the country struggles to control spiking COVID cases. The Philippines is one of the only countries in the world where schools have continuously remained closed since the coronavirus pandemic began last year. The government's decision was met with the protest from teachers and children's rights groups who said that the prolonged school closures will have long-term consequences on children's education and development. The move, which has kept nearly 2,000 schools closed, has spawned a backlash among parents and students in a sprawling nation with endemic poverty. Many people, particularly in remote and rural areas, do not have access to a computer or the internet at home for online learning. Agriculture is critically important, but sectoral performance has been dragged down. Transforming Philippine agriculture into a dynamic, high-growth sector is essential, not only because of its connection to food security and the agri-food system, but also for poverty reduction. Poverty among farmers and fisherfolk has fallen over time, but it remains far higher than the national average and nearly 3 times greater than poverty among urban households. Markets are so far holding up well in the crisis, and supplies are good. The DA also announced a massive expenditure outlay under its ALPA's COVID-191 Responsive Initiative, with a supplementary budget of 32 billion pesos. Of inputs, as well as direct government procurement and marketing of products, will likely have significant downsides if maintained beyond the pandemic. These kinds of measures would need to be dismantled as soon as possible after the crisis passes to resume their progress. Being made on the reform agenda, planning beyond the crisis. Looking ahead, policymakers are planning beyond the crisis with an initial framework developed by the Interagency Task Force We Recover as One. Planning for the post-COVID-19 rebuilding is challenging, yet it presents a unique opportunity to promote the reconstruction of an agricultural and food system that is more resilient, inclusive, competitive, and environmentally sustainable than it was before. Fear and psychological stress were produced by media coverage of coronavirus news during regional lockdowns, protracted quarantines, and financial and social challenges. Domestic violence and elder abuse are on the rise. Politicians and bogus doctors advocated unproven therapies and unverified drugs which proved to be hazardous. Through a live updates dashboard, the media played a global role in coronavirus disease surveillance and updates. The media allows the Centers for Disease Control and Prevention and the World Health Organization to intervene quickly and widely, allowing public health communications to reach a wider audience. Mass media is playing a very important role in the dissemination of the COVID-related information to the general. The 2019 coronavirus disease epidemic has received close attention from governments, researchers, and the public in various countries. In this case, billions of people are eager to get information about COVID-19 through social media. The rapid dissemination of topics and information related to COVID-19 has affected the behavior of the public during the epidemic. Today, more than 2.9 billion people use social media regularly. These social media have an amazing spread, speed, coverage, and penetration rate. During the COVID-19 epidemic, the social media platforms play an important role in dissemination information.
Can you see